Okay, this video is about Dr. Caldwell Esselstyn. He just made a video himself. I'm going to put the link to it. It's at the Esselstyn Foundation. And what I wanted to say was he talks about how the low-fat vegan diet, the Esselstyn diet, doesn't only just cure coronary artery disease, which we all know it does. He often says that people with chronic cardiac angina will get better in 2 to 10 days. And you can't completely fully resolve an atherosclerotic stenosis plaque that fast. But what's happening is you're getting restoration of the endothelial function, meaning the arterial lining cells are starting to produce nitric oxide again, and thus they're having vasodilation of the artery. And it's not just the large arteries on the outer surface of the heart. Those are the epicardial coronary arteries. It's the penetrating branches that go into the muscle of the heart. The muscle is called myocardium, so they're the intramyocardial branches. And because of that, a person can have dramatic improvement in as short as 2 to 10 days in his experience. And he has a lot of experience. And he also mentions he had a patient who had mesenteric angina that's pain out of proportion to clinical findings due to stenosis of the arteries that feed the gut. The gut's called the mesentery. So the arteries that feed the gut are sometimes called the mesenteric arteries. Superior mesenteric artery, inferior mesenteric artery. And the superior mesenteric artery is called the SMA. So he had a patient with severe stenosis in the superior mesenteric artery. And when they went low-fat vegan, they pretty quickly got better and were cured of that, which is great. So they don't have to go to surgery. They don't have to get a stent. Okay. He also mentioned patients he had who, he started treating back in 1985, and they're still alive, up until at least recently. So they lived to be about 90 to 100 years of age. Cardiac, patients with a previous myocardial infarction and open heart surgery, you don't often see them living another 40 years. Okay. They don't live that long, hardly ever. So that's pretty extraordinary. He had patients that had pain upon walking due to atherosclerotic ischemia of the leg, lower extremity. That's called claudication. We also call it PVD, peripheral vascular disease. Sometimes nowadays it's called PAD, peripheral arterial disease. And he had patients who they would keep having to stop 4 times on the bridge over the big highway to the Cleveland Clinic. And after they went low-fat vegan, after a couple months, they could walk the entire bridge just fine. Guys with their Johnson was coming back to life. And he also talked about carotid artery stenosis reopening. Okay, it wasn't fully occluded, but it was moderate stenosis, moderate to severe stenosis, and it regressed. So anyways, I'll have the link to the video below. It's a nice video. And, Esselstyn's an old guy. He's like 90-something years of age. But, he deserves a Nobel Prize. He's not in any textbook. They don't want the public to know about this. But this is the only thing that's done this with coronary artery disease, is low-fat vegan diet. All this high-fat phony BS about you have to have soy and omega-3s and olive oil, that's just a bunch of horse shit from a bunch of sellouts, the high-fat phonies. Esselstyn's telling you the truth. It corresponds to what we know from Kempner, what we know from Pritikin, what we know from McDougall, etc., from Armstrong, from the animal studies, from Sloop. It's the truth. So I'll let you hear it from the horse's mouth. This is it's a very good discussion by him. He's with his daughter, and she does a good job of kind of interviewing him and getting him to talk. So the link will be in the description below. Hope you find it helpful.